Hello viewers, this is Dr. Sangeeta Datta, consultant psychiatrist, and today we shall discuss about psychoeducation to the family member of a mentally ill patient. In our day-to-day practice, we often face a few situations which I thought should be discussed here so that it becomes easy for people, especially for family members of people who suffer from a mental illness. Usually when a patient is brought to us with some kind of psychiatric problems, a fraction of such patients would understand that they need help, especially when they are suffering from anxiety or from depression or from substance abuse, some kinds of substance abuse. They would come to us and they would seek help. But there are classes of people, especially suffering from psychotic disorders or severe form of addiction, who are not willing to come or take treatment. It is simply because they do not have the insight. They do not understand that they are suffering from an illness. And sometimes they have their own delusions and their own false beliefs, which makes them understand or makes them think that the doctor is against them, the world is conspiring against them, or perhaps that they are all powerful, they're gods themselves. So they would not agree to any kind of treatment, be it at home or be it in the hospital. They would refuse hospitalization. In that case, psychoeducation is given to family members for them to understand that this is the condition with your patient. His symptoms are such that he will not be able to understand that he needs hospitalization or medication. In that case, the decision to hospitalize a patient or even to feed him medicines will have to be taken by the guardian. And there are certain rules which we follow when we treat such patients, and it is always expected that we get the cooperation from the family members, because only with their cooperation can we function effectively and treat these patients well. Sometimes very violent, aggressive patients are brought to us by family members or friends, and they tell us, "Madam, please counsel them." Remember, counseling is not only not possible in such cases, but sometimes it is contraindicated in certain disorders. For people who are grossly psychotic, who do not have insight about their own problems, they need to be brought back to reality. And after they have come back to reality, of course, then we can go ahead with counseling. But when they're still aggressive, still violent, are completely deluded, they have all kinds of abnormal beliefs about themselves and the world, it is contraindicated to counsel them. It is rather important for the family members to understand the condition of this patient, the way it should be treated, the goals of treatment, the methods of treatment, the prognosis, and the psychiatrist would explain to them in details as to how to go about things. Sometimes it can be very difficult for family members to accept that the person who was so normal till some time back has actually come to a mental state where he or she is not being able to understand his own life, his own behavior, and he or she is not being able to judge or reason or even take decisions for himself. Yes, that is possible, especially when your brain is not functioning well and you're not feeling well mentally. Then such a person might need somebody else's assistance in his life, and especially if the person is psychotic, the guardian will have to take decisions on his behalf. Therefore, always make sure that you talk to your psychiatrist about the family member who's mentally unwell and clarify all your doubts so that you can accept the condition at the earliest and can cooperate in the treatment process so that your patient can recover at the earliest. Do remember to like this video or subscribe this video, and we promise to come back with another interesting topic. Till then, goodbye and take care.